Megha Sehrawat. Hello, Namaste and good evening to Dr. Megha Sehrawat, resource person of this evening, Mrs. Nisha and Mrs. Jyoti from NIMHANS, who are providing online and offline support for conducting these webinars. Dr. P. Shivakumar, Head of Geriatric Psychiatry Department of NIMHANS, and his team of doctors who are responsible for starting and providing all support for these webinars. The enthusiastic and inquisitive viewers and participants of this webinar from across the country. I have great pleasure in welcoming you to yet another edition of this webinar being organized by Vayomanasa Sanjeevani, an outreach arm of Geriatrics Department of NIMHANS, Bangalore. I am happy to welcome and introduce to you Dr. Megha Sehrawat, resource person of the evening. Dr. Megha is an young, highly educated and experienced doctor, especially in the fields of child and adult psychiatry. After finishing her MBBS degree from Swami Rama Himalayan University, Dehradun in the year 2015, she obtained her Diplomate of National Board, commonly known as DNB. In fact, she is a gold medalist in DNB. Incidentally, I may add for information of some of us who may not be familiar with medical qualifications, DNB and MD are equivalent postgraduate qualifications in medicine. Only the certifying institutions are different, although all of them are recognized by Government of India. As regards her experience as a specialist, she was a senior resident in Institute of Human Behavior and Allied Sciences, New Delhi, a premier institution shortly known as IHBAS. It's a tertiary psychiatry institute of repute. She is presently working. Hello, kindly mute yourself, please. She is presently working as a senior researcher in NIMHANS and pursuing her Doctor of Medicine, commonly known as DM, which is again a super specialty course. Only highly skilled and postgraduate qualified doctors will get admission for it. Needless for me to add is that she is highly experienced in treating persons with common and severe mental illness, both adult and children. She is specializing in geriatric psychiatry, including mood disorders, sleep disorders, dementia, and psychosis. We are fortunate today to hear and be benefited from her knowledge and experience in such diverse fields. Doctor, as far as we are concerned, we are a set of senior citizens who are very passionate to to remain healthy till the last. That is our passion. That is that which has united us today, and we are all waiting to hear from you. As a time management tool, I request participants to ask the questions, if any, in chat box for her to answer. You may also raise your doubts after the resource person finishes her presentation. Yes, Dr. Megha, we thank you for your time. The floor is now open to you. Please go ahead with your presentation. Thank you.
Thank you, Jamunathan sir, for such a nice introduction. Good afternoon to all the esteemed elderly citizens of the society, and thank you for giving me this opportunity to come and speak to you about depression. So today the topic is depression in elderly, and I'll be giving a very brief presentation. The main focus will be I'll try to address as many queries as I can of all of you. If I'm unable to address any, I will get back to you again also. And because of shortage of time, so we'll try to again hold another session. So without wasting much more time, I'll start with my presentation. Just let me try the screen sharing if I can do. Sir, can you see my screen?
It's fine, doctor. It's fine. It's fine. I'm able to see that. It's very clear in the screen.
Can you please increase the font size a little more? Yeah, this is okay.
And now it's fine.
Oh.
All right. So
Okay.
I have kept a very brief presentation, but I'll be speaking in detail about depression in elderly, and we'll try to do as much discussion as possible in the remaining time. So whenever we speak about depression in elderly, what do we exactly mean by depression? So depression can present in number of ways. One of the few of the common ways in which it presents is there may be increased irritability, a reduced interaction of the person, a loss of interest, especially in those activities which they used to enjoy earlier. For example, someone used to love listening to songs, someone used to watch movies, and they used to do it with enthusiasm and passion, but they stop doing it now. They don't have that much pleasure in doing these activities. Then there is difficulty in concentrating or remembering things also. They might misplace few things here and there. Whenever they are trying to read newspaper or do any, even if they are working, may not be able to focus in the same way which they were able to do earlier. Depression in elderly can also lead to slowness. We are not as fast as we were before, and we become slower in our activities. It also affects our sleep. We may lie awake most of the time at night, or we may keep on getting up intermittently multiple times. Or there can be early morning awakening also. So your usual wake up time might be, say, 5 o'clock or 6 o'clock in the morning, but you get up at 3 in the morning and you cannot go back to sleep again. In addition to this, there is also sadness of mood. Now, this sadness of mood may not be present in everyone. Not everyone will say that I am feeling sad, but they will not interact with anyone. They will remain quiet. They will just keep on sitting in one place. They won't go out to social functions and other things. There can also be reduced appetite. Whatever food they were eating earlier, it may be reduced in amount, or they may just eat food just for the sake of it. They may not enjoy it as compared to earlier. So why I keep on repeating as compared to earlier, because we have to keep in mind every person has their own behavior, their own nature. So if a person by nature is someone who does not interact much with others, who does not like going out much, that doesn't mean that we will say he is depressed. So anytime we are saying that a person is having depression, we have to see how the person was before. How do other people, how do they have known him so far in his life? So these are some of the common symptoms of depression. Now, why does it happen? The most important question which many people ask. So there can be multiple reasons for depression. To put it as simply as possible, there are certain chemicals in our brain which act as neurotransmitters. So to relay information from one part of our brain to another part of our brain, these chemicals play an important role. They act as messengers. So in depression, there is an imbalance in these chemicals. Some of the chemicals may become more, some of the chemicals may become less, and hence it affects our mood. In addition to this, people who have a family history of depression or any other psychiatric illness, their parents or their siblings, someone has had depression, they are also at higher risk of getting depression. History of any traumatic event in their personal life, any major stressor which they are going through, any major financial loss, a major personal loss which they have suffered, they can also lead to depression. Now, in addition to this role transition, so most of our elderly citizens, when they get retired, some of them may not have another alternative job opportunity after that. So suddenly they find that they are left with a lot of time, but nothing to do during that time. And earlier, whatever work they were doing, it was giving them a sense, a purpose. But now they are not getting anything. So it also acts as a stressor for them. And this can also lead to depression. In addition to all those things, certain medical conditions like diabetes, hypertension, dyslipidemia, mainly diabetes. So if it's not controlled properly, it can also increase the risk of depression. Use of alcohol, tobacco, cannabis, all these substances, they also can increase the risk of depression. So coming to the treatment of depression. So yes, definitely depression is a mental health disorder which can be treated. It cannot be cured, but it can be treated. So what's the difference? So treatment means if you take medication, now the treatment can be of two types. It can be in the form of medications or it can be in the form of counseling or therapy. Now, it depends on the patient as well as the doctor. They both discuss the symptoms, on the severity of symptoms, and then keeping all the patient's preferences in mind, the patient's suitability in mind, what
not being able to sleep.
Recording in progress.
they can take a call whether we need to start medications for depression or we need to start therapy for depression. So medications are available as well as counseling is there, in which a certified psychologist or a psychiatrist, they do counseling of the patient. They speak to them about their various issues, how to better cope with them, and it helps in treatment of depression. All right. Then in addition to that, there is prevention. How can we prevent depression? Now, depression can be prevented by following some very basic things which we encourage everyone to do, irrespective of their age, irrespective of what they are doing. These are some basic healthy lifestyle methods which everyone should follow. So doing exercise regularly, some amount of physical activity, which you do at regular intervals, every day in fact, having adequate amount of sleeping for at least 7 to 8 hours every day, having good social support system, good communication network. You may be close with your family members, with your relatives, or you may have friends nearby. So keeping in close touch with them, often meeting together, going out together, engaging in other community activities. You may go out to buy groceries, you may go out to social events like a gathering in a temple, or any society event which is happening. For example, right now this Independence Day is coming, so there will be some events in most of the societies where they'll be hoisting the flag, some small celebrations they'll be doing. So going out, engaging in all those things, these are some of the things which can help prevent depression. So that will be the end of my presentation. We'll start taking questions now. I will be more than happy to take whatever questions you all have and to address all those things. So we can start discussing questions.
Yeah. People can unmute themselves and raise the question with the doctor.
So I think one question was already raised. Mr. Mahesh raised a question. He said that we have an elderly patient, non-case of depression for more than 15 years. None of the antidepressants were effective except paroxetine, and it's not a good drug in old age. And since the patient is 75 years old, what is the alternative? He is taking 30 milligram per day. Okay, see, so paroxetine, it's one of the same class of drugs which we often give to elderly patients for depression. Coming to the point that it's good or not, yes, it's definitely not our first choice. Whenever we think about depression in elderly and we want to treat it, it's not one of our first choice of drugs. But whether to start an alternative or not, it depends on multiple things. So first of all, how the patient is tolerating the medications, whether there are any side effects or not. So even though some drugs we can say that the reason why paroxetine is not our first choice is it can cause side effects in elderly patients. But it's not necessary that these side effects will happen in each and every one. So if the person is tolerating the medications well, if their symptoms are under control, if paroxetine is working good for them, if their symptoms are under control, then we may actually plan to continue the same medicine. However, if this is not the case, he is having side effect, if he is having any problems with the medications, but the symptoms are not controlled adequately, then there is a provision that we can stop this drug and we can start another drug. But again, please do not stop the drug on your own. Consult a psychiatrist, because immediately stopping any drug will cause increase in symptoms. So when you come to a psychiatrist, we will reduce the drug, we'll start another drug so that the symptoms do not worsen. I hope I have addressed your concerns, Mr. Mahesh. Anything else you want to ask in regards to this?
Mr. Mahesh, can you just put on your video?
Otherwise, I'll move on to the next question.
Next one. Yeah. In fact, Sanjeevani sir has raised the next question.
So sir has asked, it can't be cured, treatment is to support only. So sir, why I said it can't be cured and treated is because depression is a disorder which can occur again. It's not that once if we have treated, it will never happen again. There is a chance that this problem might happen again later. It may happen after 2 years, it may happen 5 years, it may not happen again as well. But there is always a risk of having an episode again in life. So cure means it's treat like it's cut at its root level. It will not happen ever again. That's why I said it cannot be cured, but it can be treated. So there is always a risk of the disorder coming again, the episode coming again. All right, sir.
Yeah,
Then,
my question is,
yes, sir.
all diseases are like that. For
Yes, sir.
example, sugar, blood pressure, all are continuous. We are continuously taking medicines.
Yes, sir.
We know. Likewise, this depression is also a continuous problem, as you said. But it will reduced. It will be upgraded. I think this sort of discussion will aggravate the participants, because we want positive instructions. As elderly, we are already in depression in one way or other, either in-house or outside. Some people are asking us for clarification. They will give some troubles. They will burden us for some relief for them. We are more or less counselors in this field, because we are running associations. We are many people are asking some relief for their personal problem, medical problem, service problem, pension problem.
Hello.
Yeah, these things have to be addressed positively to them, whether it is going to be happen or not. But thing is, they have to be counseled positively.
Yeah.
This is my suggestion. Thank you, Doctor.
I completely
I understand his concern, but I tell you, only doctors can give only hope, and doctors have to definitely tell the truth.
But Mr. Jambanathan, some truths should not be.
So, okay, here being the audience here are all highly educated people. They can understand things. Yeah, when we tell people, we know what kind of people we are talking to, then we will tell them accordingly. That's all, sir. I understand, sir. I understand your concern, sir. I understand.
Nothing to worry. Just my views.
So, sir, I understand where your concern is coming from, but the reason why I specifically said this is because more often than not in our OPD, that's the first question which we get. That if I take treatment for 5 months, then I'm cured permanently. I will never have to take treatment. So that's why I deliberately use this sentence, because I need to convey to people that like they treat their other illnesses, they have to treat this illness also in the same way. If I say that it has to be taken, it's a treatment, then at least their cooperation increases, their willingness to take the medication for a longer term increases. So I completely understand where your concern is coming from, but that was the reason why I said that, because it's the first question which many people ask us in OPD.
Thank you, Doctor. Just I have raised one suggestion only. Nothing to worry. Nothing to worry.
And then someone,
Ramachandran has raised, Doctor. Is it true that spiritually inclined persons are less prone to depression? Is depression part of dementia? In fact, his question is twofold. One is talking about dementia, and another is, how a person gets depression. What are all the chances? Yeah.
So one thing, that whether spiritually inclined persons are less prone to depression, there are no studies which can say with guarantee that, okay, fine, we conducted a study with 100 people, 50 were following spirituality, 50 were not following spirituality, and those who were following spirituality, they had less depression. So there is no data like that. So I cannot say with 100% guarantee, but definitely whatever extracurricular activities which we get involved in, if we are doing more extracurricular activities, more social interaction, it reduces the chance of getting depression. That is true. So if spirituality is something which is giving you some peace, if it gives you a relaxation, if it allows you to interact with other people, there is a social circle for you in your spiritual circle, it will definitely act as a preventive factor for depression. That much I can say.
So that is, yes, go ahead.
Sir,
Please.
I have just gone through a course for positive psychiatry and mental wellness. In that, it does emphasize on meditation, not religious this thing, but meditation does help in combating depression. It plays a major role. If doctor will say something about it.
Yeah, again, ma'am, definitely true. So the basis behind all these things, now what they are trying to convey is that a person should keep himself engaged. They should have a circle where they are going out, interacting with other fellow human beings, preferably of their own age, and they are doing some activities together. All these things will give them a sense of engagement. They are doing something productive. They are doing something which they love to do. So it will give them relaxation. And meditation also, even if you're doing it alone, it helps you to have some amount of relaxation. It reduces your stress. And hence, indirectly, it reduces the risk of depression.
Very much true. They should keep themselves engaged and engaged in the useful activities, not only just for the sake of getting engaged, keep talking on the phone for hours together. Not like that. It should be useful and fruitful also, if I'm not wrong.
True, ma'am.
Yeah, I have, another situation, Dr. See, there is certain kind of, grief-driven depression. See, people in the older age, especially when they are in the 80s or even above 70, above 80, this time, definitely one of the other partner is lost. And they have been together for such a long time. And suddenly, see, in fact, we all know that one day or other one has to die. We know that. But notwithstanding all these things, we are so much attached, or we are so much, we are in touch with each other so much that when the person departs, this person, the other person, remaining person gets into this depression scenario. And he calls it as a grief-driven depression. See, what is that we can do for that doctor? See, in fact, I have requested him, I have such patients, we always request him to go to a psychiatrist. And probably they will be able to support him or her with some medication and this. Okay. What is that? What is the other normal things that can take place?
Okay.
Learn about emotional intelligence, sir.
Pardon, ma'am?
Emotional intelligence will help a lot.
I agree, ma'am, but see, beyond all these things only, see, these are all people who have been together in life for a very long time. And yes, see, so long as it is happening to some other person, I can always say that. See, when it happens to me directly, then that problem comes. Therefore, I think we need to definitely take into account these kinds of, see, in fact, what I would personally say is that be prepared always. But from medical perspective, I'm just asking that.
Yeah. So when we talk about grief, as you said, sir, it's definitely correct. It's something inevitable. It's bound to happen one day or another. One thing is, grief is normal. We have to understand that. If there is a loss of your partner, your parent, or any one of your close relative, then grieving for that person is normal. In fact, if you are not grieving, then that is something which is abnormal. So grieving for a particular period of time, remembering them affectionately or missing them, sometimes maybe even crying, this is normal. There is nothing wrong with that, and it's not an illness. So this becomes a problem when it's continuing for a very long time, when it's affecting your day-to-day life. You are not able to do anything because you are always grieving for them. You are not able to sleep. You are not able to eat. You are not able to focus on anything. You have isolated yourself from everyone. When all these things start happening, then it becomes problem. But If this is not the case, then grieving is something which is and completely normal for human beings. In fact, it's a healthy coping mechanism when we lose a nearby or a closed or a loved one. So when we talk about a depression, so definitely grief can also sometimes lead to depression. So when depression results from grief, if we are saying depression, it means right now they definitely need the help of a specialist, either a psychiatrist or a psychologist. It's needed. Sometimes medications may not be needed. Sometimes only therapy will be sufficient. I'll be discussing what I mean by therapy. So sometimes even counseling will be sufficient. Sometimes that may not be sufficient and medications might be needed. In addition to that, what we can do is what we advise other people also who are having depression in the absence of grief. So giving support to them, being there for them, not passing statements like this happens to everyone, why are you not talking, okay, you have been sad for 8 months now you should start speaking, why are you not eating, I also used to love him, now you are not the only one who loved him, I am not doing it like this, why are you doing it like this. So not passing such critical comments, not passing such negative comments, this will help. You have to be there to support them. You need not say anything, because sometimes there is no need to say something verbally, but just being there for them, it matters a lot, it helps a lot. So this thing we have to understand. Now when we are talking about therapy, so the most important therapy in depression which I'm talking about, it's CBT, it's cognitive behavior therapy. So this is one therapy which has been tested through multiple years. Studies have been done, patients have been treated with this. What happens in this therapy is the therapist speaks to the person. It's kind of a talking therapy. So we discuss the issues, whatever issues the person is facing, whatever problems are there, and we come up with good coping strategies, how to deal with those problems, how to change your outlook on those problems, how to change the way you are thinking about those problems. A very small example, there might be a problem which may be this small, but in depression, it appears to the person that it is this big. So in talking therapy, in counseling, we make the person realize that the problem is actually only this much. It's because of the way you are thinking that it has become this much. Again, we do not blame the patient. In therapy, we speak to the patient, we work with the patient, and they themselves come to this conclusion. And then we help them to find out what was the wrong thing which they were doing, what was the problem in their way of thinking, and how can this be corrected. That's what we do in therapies. I hope I have made some sense to all of you.
Yeah, excellent, doctor. This is really a good point. That is, I mean, to make them really understand instead of passing comments, we make them really understand the scope of the problem, and and how best to see. Please don't worry, I am with you, like that. In fact, this, weeping is a very normal mechanism in coping with that. It just reminds me, doctor. See, Swami Vivekananda in his book he writes, when his mother died, he has wept. He has wept for 3 days. So he was a Swami. But with all that, this is a mechanism, the God-given mechanism. We have to use this mechanism and come out of it. Yes, doctor. Thank you. You have made a beautiful point, doctor. Thank you. In fact, this will be very useful. This will be very useful, doctor. See, in the sense that, okay, the coping mechanism is needed. Not only medicines, there should be some kind of an adjustment in that thinking, behavioral pattern, thinking, etc., which leads to coping mechanism. And doctor, I tell you, all said and done, I tell you, the loss of your spouse in a particular moment when he or she is needed is a terrific trauma, no doubt about it. Especially any other loved one, it's a trauma. In that trauma, I think only mechanism that works is coping. Yes, doctor, thank you. I understand, doctor. Yeah, I understand the reply. Any other person has got anything?
Doctor, yes, thank you, doctor. Can you explain the some 6-7 topics you have mentioned in the opening session? Chemical imbalance, family history, traumatic events, social isolation, role transmission, substance use, medical condition. These one or two we know, but some kind of explanation elaborating each thing will be useful to the participants. 1, 2, 3, 4, 5, 7, I think you have mentioned the reasons for the depression. One by one, you can explain something.
So I think I explained at that time that chemical imbalance means there are some chemicals in our brain, neurotransmitters. So what happens in depression, there is an imbalance in their level. So the chemical which is responsible for our happiness, it reduces in amount. Now the exact pinpoint reason is not clear completely. Multiple reasons have been postulated. So this is one of the reason
according to this,
because of which depression can happen, or this is finding which is there in depression. Now when I'm talking about family history, so family history, I mean if there is any member in your family who has either depression or any other form of psychiatric illness, it increases the risk of that particular person of having a psychiatric illness. So if person A has a family history of, for example, depression in mother, and person B does not have any family history of depression, so person A is at higher risk of depression than person B. But again, this is not 100%. So it does not mean that if my parents had depression, it's 100% sure that I will also have depression. It does not work that way. Also, if no one in my family had any mental illness, I also won't have any mental illness. That is also not true. It can happen in a family where no one had any psychiatric problem, and it may not happen even if you had many people in your family who had psychiatric problem. So we are not here to increase the stigma that, oh no, their parents had this psychiatric issues, their children will also have it. No, it does not work like that. It's similar to other illness. If your parents have diabetes, there is a higher risk that you also might have diabetes. But if you follow healthy lifestyle, you may not have diabetes. Same goes for depression. So we should not isolate them or stigmatize that thing. Now coming to the next point, substance use, which I have said. So
Social isolation.
social isolation. So by social isolation, what I mean is staying alone, not communicating with anyone. Even if you're not going out, not speaking over phone also to your relatives, not speaking to your family members, just keeping yourself alone. Or sometimes there may not be anyone at home. I mean, your relatives may be staying somewhere else. You are staying alone in your house. So loneliness, it can also act as a depression. So that's what I mean by social.
Transmission, role transmission.
Yeah, I'm just muting, sir. So
Please mute, ma.
I don't think I can mute. I think
I'll mute it.
In fact, normally I should get that control. See, I have not got the control today, ma. That's the problem. That's the problem with Zoom also. But anyway, I am requesting all people to kindly mute. Only people who are talking, let them talk. Let them kindly mute yourself, sir, madam, because that disturbs others. Please.
okay, sir. Next one was social role transition, right?
Role transition.
Yeah. So role transition, I mean, in our lives, we have multiple milestones where we change our roles. We were student once, we were children, then we came into adulthood. Now from adulthood, we reach the middle age, and somewhere around 60 to 65, we reach into old age and we retire. We half of the responsibilities of household also sometimes we give, sometimes we may not give, but there is a major change in our role, that is for sure. Usually after 60-65 years of age, the responsibilities or the work which we were doing earlier, we may not continue to do that. It's not true for everyone. Some people may continue to do so, but quite in a lot of people it happens that way. So whenever such change happens, when your responsibilities change, there is a risk of depression. Why I'm saying risk of depression is, I gave an example at that time, I'll repeat the same example. For example, if you were working, you were employed at that time, you would go in the morning to office, come back in the evening, half of your day would remain occupied. Now suddenly when you are free, you are not working, you have too much free time on your hands, spare time. And if you are not someone who has many hobbies, or you are not someone who is very social, then you will tend to remain in your house most of the day. You won't do much activities, either physical or any which requires doing some cognitive activities. And this will increase the risk of depression, because suddenly you will feel that I had so much power, I was doing all those things, I had so much responsibilities. Now no one speaks to me, they don't need me anymore because I am not the main person in power, they don't respect me anymore. These kind of thoughts can come, and this can increase the risk of depression. That's what I meant by role transition.
Substance use.
So substance use, if a person is using alcohol, it increases the risk of depression. Any kind of substance, cannabis, alcohol, smoking, all, especially alcohol. If you are consuming alcohol, it increases the risk of depression. In fact, it increases the risk of other psychiatric problems also. So that's why it's a risk factor for depression.
Yes, the medical conditions.
Medical condition, most common one is diabetes. So diabetes increases the risk of depression if it's not controlled properly, because it will cause some damage to the brain also. That is why.
Very, very good explanation. Thank you, doctor. Because everything, or subtitle, titles, and explanations, this kind of explanation is very, very appreciated. And you have done very well. On my request, you have clearly given message to all participants. Thank you very much, doctor.
Thank you, sir.
Thank you.
Doctor, I have a question.
Mr. Ramachandran has raised one question.
Yeah.
Is Alzheimer's victim depressed, or is the person free from depression? Is he aware of what is happening to him or her? Is he aware of what is happening to him or her? Alzheimer's.
So if a person is having Alzheimer's dementia, and if they are having depression, it depends on the stage of dementia in which they are. If a person is having mild dementia, if it's the initial stages of dementia, the person will most likely be aware that I am having depression. They will say, I feel sad. Even though I have memory problem, the person may not remember some things, but they will say that I feel sad. They will cry. They won't eat food properly. So they may be aware. But as we go forward in the moderate stages or late stages of dementia, it's difficult for us to say whether the person will be aware or not. Usually in the severe stages, the person himself may not be aware that they are having depression. But depression can happen at any stage of dementia.
But depression is not very common with dementia, isn't it?
No, sir. No. It is common. It can happen in dementia. We cannot say that it is rare. It's there in dementia.
It's there in dementia. Probably depression leads to dementia, or can we take it that way, doctor?
It will be difficult for me to say exact number right now, but if I will say that depression increases the risk of dementia, that is definitely there. Hello?
Depression increases the risk of dementia.
Yes, it increases the risk of dementia.
Therefore, depression needs to be treated.
Yes, it has to be treated.
Yeah, that is the important message for us, is that, okay, I mean, normally, otherwise people think that whether I will get, even if I go to the doctor, I may not get a permanent cure or something like that. No, that is not the issue. At least you can stop it at a particular stage. And it will not allow it to go worsen it.
Dr. Megha, I have got a question.
Yes, ma'am.
Go ahead, ma'am.
You have been talking about psychological or therapy, CBT and RBT, etc. I was talking about art therapy, music therapy people are developing. Do you think these also help?
Ma'am, for depression, they are not much validated actually. CBT is one which has a really strong efficacy. It's one of the first line treatments for depression. It's much more effective as compared to art therapy and music therapy. They are more like, I can say, adjuvant therapies. You can do them with your other treatment which you are taking. But CBT is very intensive, very focused, structured therapy which we do. So it has specific goals and aims. We know what exact things which we are doing. So the results are more good with CBT. We know. It's like that, ma'am, basically.
Thank you. Thank you very much.
I have a question.
Please, sir.
Shastri,
Please go ahead, sir. Please go ahead, sir.
doctor, the stress causes depression, isn't it?
Yes, sir. It may be a risk factor for depression. I
Yeah,
won't
now,
call it stress causes
in
depression.
one's lifespan, stress is unavoidable. Right from student till retirement, and then final. It's various stages of life which we consider. Now, where do we exactly draw the line? Stress which can be managed and does not contribute for depression.
So, as you said truly, sir, definitely stress is there throughout our lives, and we cannot say that there is any person in whose life there is no stress.
That is required also. It's required.
Yeah.
Stress is required for motivation. Yeah,
True, sir. Truly said. I mean, if I don't have stress of earning money, I won't come to work in the morning.
exactly.
So, needed. So that is true. But the thing is, all of us have stress in our life.
Yes.
When I'm saying stress increases the risk of depression, it means that the level of stress which is going on. So some amount of stress is always there. Now we cannot quantify that this much stress is okay, this much stress is not okay. But as a person, we can, when we reach a level where we start getting overwhelmed, when we think that we are not able to function properly now, we are under too much stress, is affecting my mood, it's affecting my eating habits, my sleep habits, is affecting the way I interact with other people, I'm not able to work properly, my efficiency has also reduced. When these things start happening, it's a red flag. It means that now you have reached a level where the stress is too much for you. You are not being able to handle it. I will also like to add one thing. It does not always mean that the stress is too much. Sometimes the way we are coping with it, that also may be a reason. So the same amount of stress may be present for another person, but they may be able to handle it, and I myself may not be able to handle it. So this varies from individual to individual. That also we have to keep in mind.
Yeah, but the only thing is, unfortunately, the stress level, as you said, we cannot find out where it becomes overwhelming, and we can manage it or handle it through other means like medication, etc., etc.
So
So
like
unless
I
the
told you,
individual goes to this professional doctor and have an interaction, then only possibly they can find out the way to treat it.
But is it
So that remains subjective till then.
so when you start feeling that now you cannot cope up with it, now it's getting too much, it's affecting your day-to-day functioning, it means you should seek some help. Either do something at your work or seek a specialist, and then we can decide whether something needs to be done about your work or the way you are dealing with problems, where exactly is the problem right now. That thing we can take a call.
Yeah, unfortunately, the individual cannot identify that. That itself, that is a big problem.
No. The individual can identify. They can identify right now it's too much. This much I cannot handle. They are the one who will be identifying this.
Yeah. So that means, suppose, I am feeling that. Then I should realize, okay, I am feeling something wrong. Then I have to consult the doctor like that. But
If you think, I'm sorry I'm interrupting you, but just one thing, if you think that before consulting a doctor, if you think that there are some changes which you can make, I need to take a small break. Maybe after that break, I think I just need a small break. After that, I'll be back to normal self. You can try that also. Or you can speak to your manager at your office and tell them that change this working hours, or can some projects be allotted for some time to other. I don't think I'm able to do properly. If these small changes you can do and you think you will be able to manage, that's also one of the options. But after doing those changes also, if you think you are not able to cope up, then definitely you need to see a specialist.
yes,
thought-provoking. Thank you, doctor. Thank
very,
you.
very thought-provoking, doctor, in the sense that at least, okay, I mean, people need to, and most of the times, doctor, what happens, my personal experience is that instead of the same person feeling bad or feeling that he is not okay, this information is conveyed to him through by others. See, this fellow was better those old days, but now he is not so. See, others only feel that. Therefore, how to convey that information to this gentleman, that is the first problem. And most of these people who have some psychology issues, psychiatric issues, they never accept they have psychiatric issues. And even giving medicines to them is a very big task. Because I have come across cases where people used to mix the medicines along with food and give. Because that fellow will always say, I am always okay. You people are not okay. That is how it happens.
So that happens more in different other disorders. In depression, usually, until unless it's severe, in mild to moderate cases, they are willing to take medications. In severe depression, they may not be willing, and there are other psychiatric disorders, especially the one which you are saying that they are being given medications covertly in food. There are some different psychiatric disorders, usually in psychosis. So I think we have had one session, or if not, we'll be having another session on psychosis specifically.
Doctor, in this session also psychosis is included. That is why I just came into that. Psychosis slightly at the end of the session. I think some inputs on psychosis also will be very useful, doctor.
It's already 4:50, sir. I think it will be difficult for me because I can say few words, but it will cause lots of questions.
A few
So
words
that
is
is difficult for me to address.
Psychosis is something different from psychiatric. That is the basic understanding that we need to have. And some of the people who have joined late also, they would like to know more about CBT. See, in fact, CBT, you as you rightly said that this is the most accepted kind of treatment, therapy. I will even call it the treatment, a kind of therapy. If you can elaborate a little more on that, that will be very useful, doctor. Because
It is cognitive behavior therapy. So as the name suggests, we usually focus. So in every individual, the way we think, it affects our behavior and it also affects our emotions. All these three things are interlinked. Our thoughts and emotions. All these three things affect each other. So in CBT, we target our thinking. What kind of thoughts we are thinking. This in turn changes our behavior and it also changes our mood. So that's what we do in CBT. If we are thinking too many negative things, if we are having a negative thought pattern, CBT targets those negative thought pattern and it attempts to change it towards a more neutral or a positive stance. This automatically changes your mood. So that is what CBT in most simplest terms which I can explain.
The CBT does not include any medication, doctor.
No. It's just counseling. It's a talking therapy.
It's only talking therapy. Ashok Shetty Saab, if you want any other explanation, any more details? Shetty Saab?
No, I am clear, sir. I am happy and I am clear. Thank you.
You are clear. Thank you. That's because you have raised it, I just thought. Okay, Doctor.
Because I missed it. The term CBT abbreviation I wanted to know, plus what doctor has explained, really satisfying. Yeah.
Yes, she is. We are really fortunate today in the sense that we are getting almost all kinds of our questions answered, and our knowledge gaps, where it exists, we are able to get it filled up. So that yes, as Shastri sir has pointed out, yes, some kind of challenge is needed in life. Otherwise, we don't work. But when it comes too much, then only the problem comes. Yes, sir.
I have a question. Do people who have dementia, are they aware? Are they aware that they are depressed, or are they depressed at all? For example, Alzheimer. An Alzheimer patient, does he know? He has no memory of anything. Is he feeling depressed or not depressed, or what is the matter?
Doctor has already answered that question anyway. Please, briefly, doctor, once again.
In mild stages, sir, the person may be aware that he is having depression. In moderate to severe stages, it becomes difficult for them to be aware. But if it's the initial stages of dementia, they may be aware that they are having depression.
Are you clear, sir?
Thank you very much. Thank you.
Yeah. So, okay. See, Doctor, what are the common mental health challenges faced by geriatric doctor? Geriatric common health, mental challenges.
Depression, then psychosis. Psychosis is basically a different psychiatric illness which includes suspiciousness, poor self-care, muttering to self, doubting that someone is coming to harm them, hearing voices not heard by other people. All these symptoms can happen in psychosis. Then other illnesses which can happen is dementia. Then something known as bipolar disorder, in which there is depression as well as there is something known as mania, wherein there are episodes where they will be too talkative, too energetic, spending too much money, over religious, over familiar, risk-taking behavior. These things can also happen. So bipolar disorder, depression, dementia, in addition to that, substance use, alcohol and other things, anxiety disorders, they are also very common, anxiety disorders. These are the common disorders which we face in the geriatric population.
Doctor, coming back to this anxiety disorders, again, I think this is also one more very, very common disorders that we face, doctor. I mean, what is a very, how to cope with that? I mean, can you just suggest something? Very simple methods to cope with that.
Sir, if I were to say it simply and in brief now, I will say the methods which I have said to prevent depression. Those methods apply to all psychiatric disorders as well as to healthy aging, healthy living. So physical exercise, communicating with other people, having a social support system, getting involved in activities, doing things which you do, sleeping for adequate hours, having a healthy diet, all these things, if you do, they will act as a preventive factor for all psychiatric illness as well as for a healthy aging also in general.
Yes, doctor. Thank you.
Doctor,
Please.
One question.
Go ahead, sir.
At the conclusion, doctor, you have to say exercise regular, sleeping regularly, going out regularly, meeting friends, relatives, attending functions like that. These things can be explained at your conclusion. This kind of prevention, you have already touched some of the points. Any other left out points can be spoken. Thank
More
you.
or less these only, sir.
doctor, you were telling about the bipolar, this one. Is it some people, particularly in the middle age and all, they will be hyperactive, you use the word hyperactive. So is it connected to both?
So bipolar disorder can happen at any age. It can happen in adolescent also, and it can happen in old age also. So there are few symptoms which when happen together, then we call it as mania. And bipolar means the person throughout their life will have some episodes of depression and some episodes of mania. Then we call it bipolar disorder.
So a mixture.
Yeah.
Thank you very much.
Doctor, I am Shamuram. I want to know that most of the female citizens are taking medicine for their health problems such as BP, sugar, thyroid, bone problem, heart problem, etc. People are taking medicine years together, same medicine or some other medicine. What is the side effect of the medicine taken by these people? Please explain.
Okay. So, sir, usually the common BP, sugar medications, they do not cause mental illness. But there are some medications, some selective medications, few, which can cause some psychiatric symptoms. The most common one is which sometimes people get for seizure disorder, fits. Sometimes those medicines themselves can lead to some psychiatric symptoms like depression. So but usually, there are very few such medicines, not the general medicine. In general, the BP and sugar medicines which are commonly prescribed, they do not cause psychiatric symptoms. Only selected few medicines, most common name which you can recognize is steroids. These can cause some psychiatric symptoms.
Schizophrenia also. Schizophrenia medicine
Yes,
gives.
sometimes. But usually depression is the most common psychiatric manifestation which happens with those medicines.
Doctor, for thyroid problem, people are taking years together medicine.
Sorry, sir, people are taking what?
For thyroid problem, people are continuously years together taking medicine. Doctor advised them to take it regularly. In such cases, what is the side effect of the medicine taken by the thyroid people?
So, sir, one thing is your medicine doctor is, I think, much better equipped to answer this. But usually, thyroid medicine, even if it's taken for long term, it's usually does not cause any problems. In fact, it keeps your thyroid levels under control. And if your thyroid levels are not under control, they can lead to depression. They can lead to psychosis. So, thyroid medicines keeps your thyroid level under control, and it actually prevents you from other psychiatric problems also. So they don't
Thank
cause
you.
any.
Doctor, before we conclude, have you come across any ethical or legal concerns in this treating this the geriatric people? Are there any specific ethical dilemmas that arise when treating geriatric patients with psychiatric conditions?
Legal concerns.
Ethical as well as legal.
Definitely. See, ethical and legal concerns, we face them across all age groups. It's not limited to geriatric only. Even when we are treating adult patients, we face ethical and legal concerns. Even when we are treating geriatric patients, then also we face ethical and legal concerns. It varies from case to case. I cannot generalize it. Most common I can say is maybe if a person who is having dementia, then one of the ethical concern which might come, or legal concern you can say, is the will making of the person, whether they have made any will or not before the dementia started. Now, once dementia has started, then how much capacity they have now to make their will. These cases become a bit dicey. But I don't think that today's forum will be suitable for us to discuss that. Maybe we can have a specific topic, I mean, not topic, a specific case vignette, and then if we discuss, it will be more streamlined, because otherwise it will be very vague and too general.
Yeah,
So if we give this example and then we can discuss, it will make more sense, I think.
Okay. But what is the latest research, doctor? See, now so much of advancements have taken place, especially people, youngsters like you. I don't know what has really motivated you to take up this specialization. What is the motivation for that also? Because that will be very interesting to know, doctor. But I mean, in that, now there should be some recent innovations and advancements in that. Any specific thing, I mean, any significant one which you can think of highlighting, doctor?
Actually, sir, in the past few years, some of the new interventions have come, some new medications have come, new interventions like non-invasive brain stimulation, where you just put something on brain. You just do not make the patient go to sleep or anything. They will just sit and you stimulate their brain. These new treatment options are there, but unfortunately, none of them are as effective as the already existing treatment options. So till now, something which is very best, like it's much better than the previous ones, it's superb, it's 100% effective, something like that miraculous treatment has not come so far.
But research is going on in that field.
Yeah, research is still continuing, definitely.
We wait for that, doctor. Yes, that's. I mean, we are always hopeful of tomorrow, because every morning is a pleasant morning for us, and we think that something good will happen today. That is how we look forward to the day, doctor. Thank you, doctor. Thank you. Is there any other person, any other questions, sir?
Just I want to share my personal view. See, the human body, in total, it is the highest scientific evaluation till today. Okay, so considering that, it remains enigma, though the treatments also remain enigma only. There is no end, because the research is going on. It's good that we are fortunate that there are so many facilities, so much advancement has taken place, and it will further go. That's what I want to say. Whether any disease you take. Any comments on this? This is my personal view, open for comment.
I agree with you, sir. But sir, due to sir, it's 5 o'clock actually, and I am supposed to do some
very nice interaction we had. Thank you, doctor. We see you again sometime in some other occasion.
In fact, I mean, this is a set of, senior citizens who are very inquisitive about knowing things. And, we are all one thing, Dr. Z, behind every one of us, there are at least 10 people to whom we are going to teach. This is a learning point for us. So that's why I think we really thank you for handling a beautiful session, in that very informative session, doctor. It was very informative. and we thank you for that. And only return that we can think of for you is that we pray God to shower on you and your family all the best in life. So you continue to treat us.
Thank you, doctor.
Thank you.
Thank you, Jamunathan.
Thank you, sir.